Today, Health and Human Services. Have mic on, okay. I'll start all over. Good afternoon, everyone. Thank you for coming to the meeting of the Health and Human Service. Madam Clerk, will you call the roll, please?
Commissioner Baker McCormick,
Here.
Commissioner Marecki, Commissioner Anderson,
Here.
Commissioner Colleen,
Here.
Chair Scott.
Present.
You have a quorum present.
All right, thank you all. Next item, please.
B, Chairwoman's remarks.
I have none, but thank you all. We'll get this straightened out, so hopefully it'll work out fine today. Thank you. Next item.
C, approval of the October 14th, 2025 meeting minutes.
Thank you. May I have approval of the minutes, please?
Support.
Been moved and supported. All in favor?
Aye.
Any opposes? Hearing none, motion carried. Next item, please.
D, unfinished business. There is none listed. Moving on to new business, item 1. Requesting commission approval of retroactive 71-month management and operating agreement with 2 5-year options to renew with affiliated management group for management and operating expenses for use of common area space at the Taylor Health Building.
Okay. Is there anyone here? Good afternoon. No, we can't.
Just press it, yep. Nope, you pressed it. It might not be you. Oh, yeah, it was.
It's a secret button. Thank you.
Thank you.
Good afternoon, Commissioners.
Good afternoon.
My name is Keneal Johnson, Interim Director for the Department of Health, Human and Veteran Services. Today, the department respectfully requests Commission's approval of a retroactive managing and operating agreement between Wayne County and Affiliated Management Group, Inc. for the Taylor Clinic located at Eureka Road in Taylor, Michigan. The term of this agreement is from November 1st of 2024 through September 30th of 2030 with a total amount not to exceed $601,343. The county shall have 2 additional options to renew the terms of this agreement for 5 additional years per option. This agreement is retroactive due to delays in working with the management company to obtain required documentation that supports the cost and the development of the agreement. This space is unique in that the agreement pertains to use of the common space shared by clients and staff at the facility. So Wayne County, we own and occupy 12,100 square feet of the building. The common areas and services are shared with other tenants. Affiliate Management Group, they own the majority of the building and they provide essential services, including security, janitorial services, repairs and maintenance, landscaping, and snow removal. So we are here today to request Commission's approval to adopt the appropriate resolution approving this agreement between Wayne County and the Affiliated Management Group.
All right, thank you so much. Other questions? Commissioner Colleen?
Thank you, Madam Chair. And good afternoon, I guess it
Yes,
is.
good afternoon.
You addressed the retroactivity of it, but I noticed that this contract starts November 1 of 24.
Yes.
So that seems like a long time to work out paperwork.
It's been a painful process for those of us who've been involved.
And we've been out there a while, haven't we?
We have been, yes. Our WIC, one of our WIC clinics is located in that space.
Case for a while.
Yeah, Dr. Sheth is joined via Zoom. I'm not sure if she can speak to that. Dr. Sheth, are you with us? Oh, the Zoom is not working. Okay. I don't know.
Well,
if anybody from Corp Council has that.
Yeah.
I don't have that information, how long we've been there, but I know that TR has I know TR
Lawyer
has the
does.
history. Yes.
Hey, good afternoon. TR
Afternoon.
Winter from Corporation Counsel. This building was built through a combined agreement between the city of Taylor and Wayne County, where one provided the land and the other provided the funding during the Carter administration. They had a grant program that encouraged governments, local governments to work together to do projects. A similar structure was used for the former Wayne County RISA Annex that housed part of environmental health until about 10 years ago during our financial problems when it was sold. So this structure has been set up since the beginning that we own our own suite, but we do not own the hallways, the bathrooms, the parking lot. And the reason that this took so long and was so retroactive is that as part of the due diligence process, we wanted to review the charges and expenses that were being charged to this program for the entire complex and make sure that our correct percentage share was paid on those expenses. And it took a while for them to generate them because they own most of the building now and there are very few other tenants in the building and we're the only one that owns our own space.
I heard you say Carter?
Yes, it was done during the Jimmy Carter administration was when these grants were put forward, and
70s.
that is correct.
Thank you.
Thank you
Madam
for that
Chair.
information. Thank you. Anyone else? All right, then.
I'll move approval, Madam
All
Chair.
right, moved by Commissioner Kleen, supported by Commissioner Marecki. All in favor?
Aye.
Any opposes? Hearing none, motion carried. Thank you so much, Ms. Duncan.
I think the next one is mine.
Okay,
Moving to the addenda, item 2, requesting commission approval of an intergovernmental agreement with a 1-year option to renew with Michigan State University to launch the RX Kids programs designed to improve maternal infant health, early childhood development, and community well-being.
thank you.
Thank you. So again, my name is Keneal Johnson, Interim Director of the Department of Health, Human and Veteran Services. And again, just thank you all for the opportunity to speak with you this afternoon. So the Department of Health and Human Veteran Services, we respectfully ask for commission support to bring a bold and innovative program called RX Kids to 6 cities in Wayne County. This evidence-based program is not only innovative, but it is an investment in our families, communities, and our future. RX Kids is a program within Michigan State University's Hurley Pediatric Public Health Initiative that is led by Dr. Mona Hanna. Dr. Mona is the Associate Dean for Public Health at Michigan State University College of Human Medicine and the founding director of the Michigan State University Pediatric Public Health Initiative. Dr. Mona, who is a pediatrician and worked 10 years of her career here in Detroit at Children's Hospital, she is recognized nationally for uncovering the Flint water crisis and leading recovery efforts. Dr. Mona and Michigan State University Pediatric Public Health Initiative, they have the capacity, existing infrastructure, and experience to lead this RX Kids program, planning, implementation, evaluation, and dissemination. So I know many of you have heard about RX Kids, but you're still wondering, what is RX Kids? So RX Kids, it provides, the program provides direct cash allowances to mothers during pregnancy and their babies' first 6 months of life. Expectant mothers residing in select Wayne County communities will receive a one-time prenatal cash benefit of $1,500 upon enrollment when they are at least 16 weeks pregnant. After that, they will receive $500 per month post-birth for the first 6 months, for a total of a $4,500 cash benefit. RX Kids is expected to launch in 6 of the highest need communities in Wayne County. Those communities are River Rouge, Inkster, Highland Park, Hamtramck, Melvindale, and Dearborn. These communities were selected due to their significant economic challenges, including high social vulnerability index and childhood poverty rates that exceed 35%. RX Kids is already proving to be successful in Flint and other areas that it's launched. The success has shown reduced financial stress, improving birth outcomes, and giving families the stability they need in the earliest, most critical months of a child's life. So why does all of this matter? Well, it matters because poverty is one of the strongest predictors of poor health outcomes. And in Wayne County, too many of our children are born into environments where financial instability undermines their health before they even take their first breath. We see it in higher rates of low birth rate, higher infant mortality, and increased developmental risk. So RX Kids, I want you to think of this as more than just a cash program. This is truly a public health intervention. It ensures parents can afford housing, food, diapers, and transportation. All of those are basic needs that can make a world of a difference to a family. It's really about dignity, security, and hope. And this initiative aligns directly with the county's mission to create healthier, stronger communities. And it leverages partnerships with philanthropy and local government, maximizing its impact. Wayne County Executive Warren Evans fully supports this RX Kids program. His leadership has consistently championed bold, innovative solutions that address root cause and not just symptoms of poverty and poor health outcomes. So Wayne County, we've already been a place of leadership and innovation. Just this year alone, we've received national recognition for 3 of our programs due to their innovation and impact on the community. Thanks to you all and your support for passing those programs and allowing us to launch those programs in the community. So Wayne County, we have set the blueprint for others to follow, and we intend to keep leading the way with your continued support. We've never shied away from taking bold action to support our most vulnerable residents, and supporting RX Kids gives us a chance to lead yet again, to make Wayne County a model for how we can invest in families from the very beginning. So I'm asking you to envision a Wayne County where parents who live in the most vulnerable areas do not have to choose between paying their rent and buying baby formula, where babies are born into households that have the resources to give them a healthy start, where we tackle infant poverty, not with rhetoric, but with proven evidence-based action. So your support to pass RX Kids and bring this to these 6 communities in Wayne County, it's not just a policy decision. This is a legacy decision and a chance to create lasting change and to give every baby born the foundation they deserve. So we thank you for your consideration in launching RX Kids. And with that, I'd like to introduce Dr. Mona Hanna, the pediatrician and director of Michigan State University Hurley Children's Hospital Pediatric Public Health Initiative. Dr. Mona is a nationally recognized child health researcher and advocate. Grounded in community-based participation, Dr. Mona and the Pediatric Public Health Initiative work with many local and national partners to boldly improve child health equity and share best practices. So Dr. Mona?
Thank you, Dr. Johnson, and let me apologize because I think I said Duncan before.
It's okay. All day I'm apologizing for getting people's names wrong. I understand.
All right. Thank you. And thank you for that great presentation. And I think most of us know about Dr. Mona.
Oh, good.
Thank you.
And thank you so much for being here, Dr. Mona.
It is an honor to be here. Thank you, Chairwoman. Thank you, Commissioners, for your time. Thank you for your commitment. We have been working together with champions at Wayne County Health Department, I feel, for like 2 years, thinking about this, thinking about how to bring this. And today's a big moment that we're finally here and continuing the great progress. So thank you to all of you for being so committed to the residents of your county, being so committed to bringing forth evidence-based interventions to improve health, hope, and opportunity. There's not much more I can say because Keneal said it all, but you are getting several things. One is an information packet about RX Kids, which kind of broadly summarizes what the program is. It is bold and it is innovative, but it's also really common sense, and it's not new. This is done across the world. 70% of countries have some sort of child cash allowances. This is common everywhere. We as a nation also did something like this in 2021 during the expanded child tax credit. You may recall during COVID, almost every family got monthly unconditional cash allowances, and that dropped child poverty to the lowest level ever in this nation. But unfortunately, that was not renewed by one vote in the US Senate, and millions of kids went back into poverty. So that was an inspiration for ARCS Kids to provide more proof points that we don't have to shrug our shoulders with child poverty, that we can be like other countries and we can do things that are prevention-driven, evidence-based, and child-centric. So this is bold and innovative, but once again, this is done across the world. ARCS Kids, like Keneal mentioned, is laser focused on moms and babies. If you look at your packet on page 2, there's a graph. I love graphs. I'm an academic total dork, but this graph really kind of delineates why ARCS Kids is for moms and babies. The mom-baby period is the poorest across the whole life course. Babies are expensive. It's estimated that first year of life is an added $20,000 when you think about childcare and diapers and cribs and car seats, all these things that babies need. Income drops, moms come out of the workforce, we have no paid leave in this country. So this is the most economically vulnerable time in the whole life course. And as a pediatrician who got her roots right here in Wayne County, it is maddening that this is the most economically vulnerable time because it is the most consequential time in a child's life. What happens in this brief window shapes your whole life course. Your brain doubles in size in this first year of life, and so many of our families are struggling. So that's why ARCS Kids is kind of laser focused on moms and babies. It started in Flint. We are now in 11 communities across this great state. We are soon to expand to dozens more communities, and we're about to spread to other states as well. People are yearning for common sense solutions that are bipartisan, that are fixing the housing issue, fixing cost of childcare, fixing maternal infant health issues, and also providing local economic stimulus. We have several reports out that also share that this program is supporting local communities, supporting small businesses, childcare facilities, landlords, and creating a tremendous return on investment. So lots of outcomes, lots of cost savings already. It's a beautiful public-private partnership. This is run by a university in partnership with a nonprofit, in partnership with the state, with municipalities, with other foundations. So many partners at this table to bring this program, and we're so excited to bring it to Wayne County. You also have one of our bears. This is our newest spokesbears. This bear is named Hope. We released Hope a few months ago when we launched in Clare County, which is a really poor mid-Michigan county. But if you think about it, every baby, every family needs a little bit of hope. And I'm going to share one final thing. Every baby in an ARCS Kids community, so ARCS Kids is for places, it's not for people, it's for poor places. We have lots of data use agreements, including with birth certificates, with vital records. So we know every baby born in a community. And to make sure that we are reaching every baby, although 90+% of people sign up in pregnancy, and we have about a near 100% sign up rate, but to make sure that we are reaching every baby, every single baby in an ARCS Kids community gets this welcome packet in the mail. And I just want to share some of the nuggets in here. They get a personalized welcome card, like "Welcome to the world, baby Keneal. We are so happy you are here. Sign up for the program. If you haven't signed up, click on this website and learn about local awesome resources that your community offers, like WIC and home visiting, blah, blah, blah." And then this packet also has the cutest things ever, 2 adorable onesies, one that says love, because fundamentally this program is about love and how we should be loving our babies. Another really cute onesie that says best baby ever. And then one of my favorite things in here is actually a card from the governor of Michigan, because the chunk of the money supporting this program is from the state of Michigan. And the governor of Michigan sends every baby this card who's in the ARCS Kids community that says, "Dear newest Michigander, welcome to the world. On behalf of all Michiganders, we are so happy you're here." And it goes on to say how much we love you and support you and can't wait to see what you become. So in some ways, this work that we are doing together, yes, we are eliminating poverty for babies. We are absolutely doing that. We are improving health at a population level. We are reducing disparities, but we are also very much changing the narrative. We are changing fundamentally how we as a society should be caring for our most vulnerable individuals. And it is, once again, an honor and privilege to be able to do this work with all of you. And we look forward to any kind of questions or comments.
Thank you so much, Dr. Mona, Dr. Johnson. We need some innovation now.
Solutions.
And we're going through some difficult times at this moment. And I know that the district that I represent truly needs this. And I'm so glad that they're going to be a part of this. So thank you. And have questions, anyone? Oh, yes. Monique?
Thank you,
Mhm.
Madam Chair. Great program.
Yeah.
I have always been an advocate for proactive
Mhm.
help and
Prevention.
assistance rather
Prevention.
than
Costly
on the-
Band-Aids after the fact. That's
Exactly,
all we do. We put
exactly.
Band-Aids, we spend a lot of money, too little, too late, and we don't prevent problems.
Yes.
Exactly. So I just commend you on this program. Do you know how long, and I guess you would know, the Flint program has been in existence?
Yeah.
And
Yeah.
how many participants in Flint?
Yes, so Flint started in January of 2024. We have a dashboard on our website that updates every week. You can find out how many participants in every one of our communities. And you can also find out how much cash has been prescribed and the demographics of those communities. So in total of all of our ARCS Kids communities, I know that we have prescribed already over $16 million in cash to about 4,000 families. By and large, our families enroll in the prenatal period. Over 90% enroll in pregnancy, so they get the benefit of that $1,500 in mid-pregnancy. And we also know the demographics of our participants, and by and large, they are all struggling to make ends meet.
And speaking of demographics, I wish this was available to Detroiters because that, part of Detroit, and I'm hoping that somehow it,
Gonna happen, girl. Yeah, I promise you.
Oh, okay.
Once again, I trained here,
Okay.
I got real frustrated real quickly taking care of babies in Detroit and not being able to treat the pathogen of poverty. We are going to bring this, I will pinky promise you, we are going to bring this to Detroit, thanks to more state funding. It's more likely to happen. It's still a public-private partnership, but a lot of my energy is spent right now making sure that we can get this to Detroit kids too.
And the demographic that we assist, because these dollars are coming from the American Rescue Plan dollars, right? From the county. And then you said that's 7 million from us. And then from the state, how many? And what's the overall breakdown as far as the expenses for the administration of the program versus how many participants will actually benefit from the dollars that we're approving?
Yeah, maybe once Keneal can look for the numbers of how much the state is contributing, but I can tell you about the administration. So the program is led by Michigan State University. And we have a partner at the University of Michigan, but the administration of the program is done by a nonprofit called Give Directly. So when we were envisioning this program, I'm like, I know what kids need, but I don't know how to get people money. So we didn't want to reinvent the wheel. We went to the international leader in cash transfers. This is all they do. So Give Directly administers the program. They enroll folks on the website. It's really easy, arcskids.org. It's a mom-attested application. It takes about 20 minutes. Folks enroll. There is a robust verification process to make sure that that person really lives in that community, that they're pregnant or they've had a baby. We also have data use agreements with birth certificates, so we actually know when babies are born. And then there's safeguarding of our mothers and families. There's fraud detection. And then the cash gets transferred by and large directly to a checking account. So the administration of the program is very small, not more than 15% total is the administration of the program. And that is one of the reasons we have really garnered bipartisan support because of the efficiency. For example, the Mackinac Center, which is a libertarian think tank in Michigan, loves this program because of its efficiency, that it really champions small government. We're not hiring people. There's not tons of staff figure out administering the program. It is by and large a very lean and efficient operation. And I don't know if you've.
Is it a requirement to be a US citizen, or is this for
everybody? And we have other philanthropic dollars in the mix, which cover everybody.
Okay.
When something is for everybody, once again, it makes it very easy to administer. We don't have to figure out who's in, who's out. We also get that really high take-up rate, which is near 100%. But once again, it also sends a really different message that you're welcome here, that we support you, we care about you.
And the last question, as far as qualifications, to apply, what does that look like?
That is a great question. So once again, ARCS Kids is for a place. So we have ARCS Kids communities. So somebody has to live in an ARCS Kids community. So right now, if you go to our website, arcskids.org, if you're in an ARCS Kids community, you can apply. You have to be at least 16 weeks pregnant. And that you have to upload verification that you're beyond 16 weeks pregnant, and that has to be through my healthcare provider, or you've had a baby and verification of having a baby. So it's just your residency and your pregnancy infancy status.
But no employment or income?
No, this is about, this is for a poor place. Not for poor people. So we're kind of means testing a geography. We're only going to communities of high need. When we do something for a whole community, we can really tackle those disparities that are place-based, the historic, systemic, compounded issues that make it really hard for some kids in certain zip codes to be healthy than other kids. Because in those poor places, it's maybe worse environmental quality, or there's not many grocery stores, or the schools aren't as great. So all of these other things make it hard for kids to be healthy. So that's why we're putting into place a place-based intervention, and it's administratively more efficient and has a higher take-up rate. And lastly, conveys things like dignity and deservingness. It's kind of like universal school lunches.
Is great. My concern is whether we're helping the people that really need the help versus someone applying to, if I can get $4,500, that's just extra, versus someone that really needs it. That's my concern. And I don't know if you've thought about how to better manage that part of it. I know that's tricky.
Yeah.
But I think it's something that should be considered. Yeah.
That's a great, yeah.
And then communicating this to the communities that you're in. Okay, we're really looking for those that really need versus, I'm not sure how you manage that part, but
Yeah,
it's an excellent
Yeah.
idea. I love it, that we're going to help communities that really need the help, because I know they do need help.
Yeah, it's hard. Everybody, no matter your income level, this is the time that people struggle the most. It's also a really short program. Other countries do something like this until 18 years of age, and for everybody, it's universal. So this is a program just for poor places. So that's how we're targeting those who need it the most. And I wish, if we added any kind of complicated eligibility requirements, it would be more expensive to administer, and we wouldn't have as much take up. So right now we're focused on really needy places.
And how are you communicating it?
So everybody gets something after they're born. We have, I think you got little rack cards as well. So we have materials that will be in birthing hospitals. We have close partnerships with health systems and WIC clinics. We have social media, we have communications. So one thing, I spent my whole life trying to find hard to reach people and get them to sign up for the stuff. This is a different kind of situation. We have 100% take up rate for this program because it's easy to sign up. And people really value it. It's very popular. So once the announcement is made that this is ready to go live in these communities, there will not be any problem. By and large, the most common ways people find out about the program are word of mouth and social media. I was in clinic on Friday taking care of adorable little babies, and I asked every mama, how did you find out about this program? And it's usually 12 people texted me when I was pregnant. So it's a lot of people hear about it.
And we're also identifying local champions within each of the communities that this is being rolled out in, so they can kind of help spread the word and talk about how the program works.
And I would love to have something to share as well as soon as we roll it out.
Yeah, do we have?
So I am in full support. Yes, thank you.
Thank
Thank you
you.
for indulging me
Oh my
and all
God,
the
these are
questions.
great questions. And,
Yeah, because it's not only the questions that I have, but the community has questions as well. So thank you.
Thank you. Thank you for bringing out that additional information. And this is not new. They've already did it in Flint,
Yes.
11
some other
11
places,
communities
yeah.
in Michigan.
So it's well on its way. So thank you. The physical advisor, would you like to have something to say?
Yes, thank you to the chair. quick question on the funding. I know you mentioned this was ARPA dollars. Are these ARPA dollars or are these the post-ARPA general fund dollars?
They're the post-ARPA general fund dollars.
Yes.
Thank you.
Thank you.
Thank you so much. Any other questions? Commissioner Killeen?
Thank you, Madam Chair.
Certainly.
And I'm glad my West Side Detroit colleague raised the issue of the city, and I wish you good luck over there as an East Side Detroiter. But just a week ago, the study came out that 51% of the children in Detroit are living in poverty. So a huge need. I'm going to stay on the money for a minute because, I see the $7 million, but I also see in the fiscal analysis that the Wayne Project Public Health Sustainability shows $2,750,000. Are those the same dollars? Are we, is that just what is in that account right now? Or are we going to do this a couple million a year to put dollars into it? So I don't know if our fiscal advisor has any insight into that. This one. I've got stuff in a few places here.
I don't have visibility to what you're looking at, but I know that there is a $2 million gap that we are working with our philanthropic partners to fill in the gap. So I don't know if you're referring to the 2 million.
Well, I don't know. I'm just looking at the. Yeah, so it's going to be 2 million a year, a little over 2 million a year, running 3 years.
So the program is,
Different.
it's a 2-year program. The total cost over the 2 years is 7.5 million. So
Yeah,
it'll
over
be
3 years.
For over the 2 years.
Okay.
Or three fiscal years? Okay. Yep.
Okay.
But that
Alright.
draws down about $11 million from already allocated state.
Into the mic, please. I can't.
That amount, the Wayne County contribution draws down about $11 million from already allocated state money.
Yeah, yeah. And I see Michigan State does fundraising for this program as well.
Everybody does. So Michigan State does, Give Directly does. Our partners, our local municipal partners, all support it. The city of Dearborn raised several million on their own to help support it as well.
Yeah, well, we would be what, the 7th or 8th location in the state to run this?
We're in 11 locations right now.
Yeah, 11.
So
So we're the 12th.
There's one that might sneak in before you next week, but you're going to be in the top
I'm just thinking
15.
the ability to raise funds and to expand this program over time. I guess we have to wait and see on that.
So in the state budget that was passed, that was signed about a week and a half ago, 2 weeks ago, there was a significant allocation of TANF and general fund dollars to support this program.
New money?
New money,
Okay.
$250 million in general fund dollars from the state of Michigan went to RX Kids. We're still working on the details, but that is going to make it a lighter lift from philanthropy.
And have you collected any data on families in these different 11 in terms of smoothing out the bumps? What kind of data has been collected in these areas and the effect on the families and the kids?
Oh, that's a great question. So we've collected lots of data because we're, once again, academics. And by and large, what we hear in multiple surveys in all of our 11 communities is that families are pretty much spending this money on the same things. Number one expense is baby supplies. And when you break it down, it's diapers. That's the number one thing that folks spend their money on. Then it's food, rent, and utilities, and that's all consistent with the national literature on child allowances. We are also hearing a lot of impact and seeing it in data on family financial security. We have more housing stability. In Flint surveyed families last year, we actually had no evictions in our surveyed families. People had less back-owed rent and were more able to pay their mortgages on time. We had improved nutrition security. Families were more likely able to afford the food that they can get. That translates into decreased stress. So we have improvements in maternal mental health in all our sites. Not only qualitatively, are families saying they can breathe, a weight's been lifted off their shoulders, they have time, they have bandwidth, but also we have measures of decreased postpartum depression, decreased parental stress, and decreased parental anxiety. We have a paper that was published last week in the Journal of American Medical Association on prenatal care utilization. We have a significant increase in folks going to prenatal care, going earlier in the first trimester, going more often. Also in big data in our communities, we are seeing a decrease in smoking in the third trimester, an increased kind of recognition of pregnancy-related conditions because of the increased access to care. And it was mentioned by Keneal, we are also saying population level improvements in birth outcomes. We have less premature babies, less low birth weight babies, and less NICU admissions, which also translates to acute cost savings because by and large, these are Medicaid expenses. So we have lots of data, big data, anecdotal data, qualitative data, but by and large, you can think of this as really kind of addressing a lot of the poly crises that residents of our state are facing, be it housing affordability, the childcare, the impossible cost of childcare, the price of eggs, the inflation, health issues, economic development. So this is kind of touches on all of that. And those impacts are all on our website and in this packet.
My last question would be then, when does the department kind of plan on coming back to the commission after a reasonable amount of time to say, this is how it's working in Wayne County, discuss some of the data that we might have by then? When will a follow-up report from the department come to this committee?
I know we do provide you all quarterly updates on the status of all of our Well Wayne initiatives, and so
You're going to fold it into that?
yes, this will be folded into that.
Okay.
And I would also add that, once again, on our website, we have a dashboard where we push out data almost at the same time we get it. So every week that updates with a lot of things that are usually in reporting.
By community?
By community. So you can actually click on Melvindale and you'll see how much cash is prescribed. You'll see the demographics of the community, and you can also see different impacts.
Well, we use data-loving doctors and academics.
This is data driven.
Yeah, thank you. Thank you, Madam Chair.
Thank you. Yes, Commissioner Monique.
Thank you for indulging me one more time. My colleague reminded me of a question as it relates to the number that will be served from the dollars that we're allocating over the 2-year program. Do we know how many that would serve in each community?
Mm-hmm.
And is it a way that we could divide those up into, we have 6 communities, maybe, I don't know what the numbers look like, but say 100 in this community, 100 in
We're
that.
doing everybody. It's everybody. Everybody's eligible. It's for every baby that's born in each.
Right, and I'm asking, is there a number that we're looking at serving? And is it a way that we can divide it up into communities? So the numbers that we're serving, 100 in Hamtramck, 100 in Melvindale, 100, just so there's some fairness, I guess, to the program. So say, for instance, one community takes up the bulk of the funds. Is there a way that we can monitor that to make it, I don't know, maybe it's just me always looking at fairness. I do. That's my bad. But I'm just wondering, is there a way that we can look at that, or is there a need to even look at it that way? You see what I'm saying?
Well, it would depend on how many babies are born in each area.
Right.
So
You can't say, hey, Dearborn, you can have 1,000, and Hamtramck, you better have 1,000. That would be fair.
Well, that's why I'm mentioning this, because if it's 1,000 born over here and we've allocated all in that community, is that being fair? I'm just looking at the fairness of the program. That's all.
So
I
some-
get what you're saying, but I don't know if there's a way that we can make
All
it
those-
more fair.
So all of our estimates of the cost of the program are based on vital records birth certificate data. So we've looked at every community and how many babies historically have been born in every community. And then we also look at the Medicaid rate. So how many of those babies were born on Medicaid? Because that really tells us where the greatest need is for this window. Also, the Medicaid, being a Medicaid baby, is how we can pull down some of the state TANF dollars. That's how we reimburse TANF. So
Okay.
more is covered by the state. Some of these cities are really little, like, Highland Park only has an estimated 80 births per year, whereas Melvindale has 133 births per year. So, in some communities, we launched in Royal Oak Township a few months ago. They've only so far had 2 babies born. They think they have 20 births per year. So every community is
It's
different.
Yes.
But it's, there's no cap, there's no limit, and we want to make sure that we have enough funds to cover every baby in that community. And the more need there is, the more that we can pull down the state dollars instead of the other dollars that come in.
Yep, and again, I'm for the program. It's just the equity in it
Yeah.
and not
Yeah,
one community,
right. And we-
getting
right.
all of the
I
dollars.
love it.
If there was any way.
We are
could do that.
driven by the exact same premise, and that's why, because of equity, we are starting with the greatest need communities. These are the
Right.
communities that have the greatest disadvantages on tons of metrics, and that's why we're starting with these communities.
Right, but if that community has a need, you pointed that out, but then they don't get it because another community has a need as well. I'm just
I know.
looking
I wish
at
we could do
if
it
we
for
could look
everybody.
at how we could give dollars to each community evenly.
And I will say that on page 23 of the contract, it does address kind of your concern.
Right,
And so there is language that talks about the amount reflects Wayne County's proposed allocations towards the RX Kids program. So we're going to continuously monitor how much is being distributed to each community.
thank you,
And
That's it.
make adjustments as needed.
thank you.
Thank
That's-
you.
Commissioner Memrecki?
Thank you, Madam Chair, and thank you for your presentation. I have a couple questions first. I'd love to see where the Mackinac Policy Center supports this, because I cannot find that they've publicly done that. So if you could shoot me anything.
But an op-ed that was published in Bridge Magazine.
Okay.
By the Director of Research at Mackinac Center. It's Why Milton Friedman Would Love RX Kids.
Okay.
So it was published about a month or two ago by Michael Van Bork. Actually, it's quoted here in your packet as well, where he talks about it. Compared to the ways that governments typically spend taxpayer dollars to try to alleviate poverty, these kinds of direct cash subsidies are among the most efficient ways that governments can achieve these kind of goals.
Hey, who's the author?
It's Michael Van Beek, Director of Research at the Mackinac Center for Public Policy.
Okay,
And he
thank-
wrote a article in Bridge Magazine, Bridge
I
Newsletter.
will definitely read that. I could not find anything. Just a quick question about these surveys. Are you going to be surveying people after the money's gone
Yeah, we're
and seeing
already,
what they're doing?
yeah, we're already doing that. So
Okay.
Flint's been around the longest. So we have folks that have graduated from the program. We've also had folks that have finished the program in Kalamazoo and in the Eastern Upper Peninsula, 5 counties in rural Michigan. And we conduct surveys after the fact to see how they're doing. And a lot of the things that we're seeing a lot of maintenance of effect, which means that even after the program's gone, families are more stable. They're more on a solid ground because once again, it's addressing kind of that economic shock of that perinatal period.
And I agree with everything you're saying. And I agree with the communities that have been targeted with this. My biggest problem is that everybody's getting this. I mean, you can make $200,000 a year and you can sign up for this and get this. That's my biggest issue with this, that in talking about fairness, that's a real stickler for me. In fact, I can't even like grasp my head around, because everything we've done with the kids programs, with the eyeglasses, all that, we're not giving every single kid eyeglasses. We're going into schools that need eyeglasses, that can't afford eyeglasses. These are all taxpayer money. And I'm all for giving anybody like a hand up like this, but my stickler point, and I get it. I figure that everybody was involved in this because of the difficulty of weeding out people. Like you said, it would cost more, it would be more expensive. But what makes someone that makes $300,000 in Dearborn different than someone that makes $300,000 in Grosse Pointe? And the person in Dearborn's getting it because the community is a little bit different, but the other one's not getting it. So fairness to me is like blatant in this proposal. And again, I get what you're saying. I mean, yeah, everybody that has kids, it does, I raised 4 kids, and it does, you know, it's a whole different thing as each kid comes in. I have several grandkids, and it's just a fact of life. So that's my biggest problem with this. I just want you to know that. And I get the kind-heartedness. I understand all that. And I think, like Commissioner Scott was saying, her area is very, very needy. Totally get it. But this is just inherently not fair to me. So I just want you to know that. But I appreciate your enthusiasm, and I appreciate why you're doing this. That's a real stickler for me. So I appreciate that. Thank you.
All right, are there any other questions? Yeah, Commissioner Anderson?
Thank you, Madam Chair. I love the intent of the program, I really do, and I think it could make a huge difference and probably has done so in other areas. Do we have, I'm sure there's other communities that are using this go directly or give directly. And do we have a track record of that organization?
Yeah, so the nonprofit Give Directly, which administers a program, is all over the world. They do cash transfers. They are the largest administrator of cash transfers, and they do a lot of similar programs in the U.S. In Cook County and Mississippi and Arkansas. They do a lot of disaster relief as well. Cash transfers after disasters. So they are kind of the best in class, which is why we chose to work with them. And ARCS Kids is something that they have been involved in from the very beginning, from the design and the continuous improvement of its delivery as well.
So if someone qualifies for this and they go through the program and the child is delivered and we have some follow-up, right, with the mother and opportunity to see the child, a doctor or someone that would be able to assess whether or not it's made a difference with that child. Of course, that's hard to determine because we don't know what it would have been without, but we know it's played a part in it, the good health of the baby. What happens after we have that period of time that the money is coming in, that we have some assurance or hand in, I guess, counseling the mother to make sure that things that the child needs are being taken care of first, that other things aren't being spent, money's not being spent on other things that, and because that's a concern to me as to whether or not, and we'd like to think that all expectant mothers are very responsible and would think about the child and think about it, but I know there's things that get in the way sometimes of how the money is spent. And I don't know that there's anything that you have in process that would talk to the mother and ask, that, look, this is what this is designed for. And I know that's still a certain amount of just, I guess, expectation that the mother would spend it on the child. But do we have any in the program? Is there counseling as the pregnancy is proceeding?
So the first point you had mentioned about how kids are doing after this. So we actually are able to objectively measure how kids are doing who've received this. And we compare that to other control populations in the state. So our research kind of really employs rigorous controls. So we actually can very comfortably say, because of RX Kids, we have less premature babies. We have more prenatal care. We have less smoking among pregnant mothers. We have improved uptake of programs like WIC. So we can very confidently say that because we have control populations. In the surveys that we also do research with, we also have 3 other control populations that tell us that, yes, our moms do have less depression compared to other moms. So we are able to share kind of very scientifically the outcomes of this today. After every cash transfer happens, a mom has to complete a short survey. I got it, I'm safe, I'm okay, everything, you know. And then at each moment, from the point of enrollment in the program to offboarding, because there's an offboarding process, families are also directed to websites that the communities help create. So on those websites, and those websites are full of resources. It's in this welcome card, it's in many touch points throughout the process. And those communities have come up with lists and lists of amazing resources that families can take part in. And in addition, Give Directly also offers benefits counseling to help kind of folks with those issues. So there are many opportunities within this program for folks to get connected to parenting support programs, to get connected to WIC, to get connected to a home visiting program, to get connected to financial literacy, to get connected to Head Start, early childhood. The list goes on. Those are all developed by communities and pushed to the participants.
Good. I was concerned that it would not just abruptly stop at 6 months and there would never be any further assistance.
No, yeah, and once again, I wish this would continue for longer. Like Canada, this goes to 18. The child tax credit went to the age 18. This is normal. Universal child allowances, child benefits are normal in other countries. It's an investment in the nation.
The other thing, I know the number of cities, I think there's 6 that the focus is going to be on those initially. And is it going to be open then to other communities that after that initial period of time? Is that the plan?
That is the plan. With the investment that the state made, that is the plan, to be able to expand this to even more communities. And that'll be a conversation we'll be having hopefully early next year with you.
Right.
Yeah.
And I know there's circumstances that an expectant mother may find herself in and a move or whatever. It could be, a rough relationship and trying to do it for her own safety. So I would hope that there would be that flexibility in the program that they would still be able to get that assistance.
So that's a really great point. So one of the most housing unstable times is pregnancy, infancy. 30% of low-income families are housing unstable during this period. The majority of folks in the largest demographic of folks in shelters are families with very young children. So we're already seeing an impact on evictions and housing stability. Often moms are couch surfing or living in shelters. Even the threat of eviction in a community, not even a personal concern, but even if it's happening in your community, increases your risk of premature delivery. So even just evictions happening in your community increases the likelihood of a baby born preterm.
That's all I have right now. Thank you. Thank you so
you.
much for bringing this forth.
Any more questions? Okay.
One more
Monet.
time.
Yes.
So is there a way that we could make this for low income, or just at least put in the communications that it is for low income families to eliminate the possibility? Well, it's always possible, but to eliminate anyone applying, because if you read it, it doesn't say or indicate that, it's for low income families. So to Commissioner Marecki's point about someone that's making 300,000 in one area and they still apply and they still get the extras. Have you considered that, or is that something you can consider?
Yeah, so everything we do is based on data and science and facts and evidence. And by and large, the global evidence is for universal cash transfers for children, especially for young children. This is a program for low-income places. It is not for low-income people. That completely changes the design and the cost, and the messages. Just think of universal school lunches. So we don't, like, this is something that we now agree upon. All kids need healthy nutrition, right? We shouldn't create stigma. Some kids, everybody should have healthy nutrition. Everybody in this critical window should have a strong foundation. So the program is, once again, for low-income places, not people.
Thank you.
Thank you. I see that our Madam Chair is here. Would you like to have any words? All right, thank you. All right, thank you so much for being here. Thank you so much. There are no perfect programs, but we thank you for this.
Thank you.
And we will work with you on this. And so I am truly grateful that we give them a healthy start in life.
Thank you.
Thank you all so much. Can I have a motion?
Moved.
So moved by Commissioner Anderson, supported by Commissioner Killeen. All in favor?
Aye.
Any opposes? Okay, one opposed, Commissioner Marecki. All right, thank you so much. Motion carried. Okay, next item, please.
Moving to item 3, forwarding the MEO turnaround time analysis from July 2025 to September 2025 report.
Okay. Good afternoon. Would you put your mic on, please?
Thank
All
you.
right, thank you.
And Madam Committee Chair, good afternoon, Commissioners. Good
afternoon.
afternoon. I'm going to try to get through this fairly quickly because I know we're short of time. My name is Carolyn Nimmo, Deputy Director of Health and Human, the Department of Health,
Yes.
Human and Veteran Services. And I will be presenting just the key points from the MEO turnaround time report. And it's for the fourth quarter. The time period of that is July 1st through September 30th. So for this quarter, there were 3,864 decedents reported to our office, of which 703 cases were accepted. The forensic team completed 708 procedures, including 450 full autopsies and 237 inspections, and 22 limited autopsies. To support accurate case resolutions, 265 cases required histology evaluations involving tissue analysis, and the average turnaround time for histology was 6.2 days. So moving to the cause of death determinations. Of the 708 cases mentioned earlier, 537 received a final cause of death within the reporting window, and that's more than 60%. And with the average turnaround time for that, 17.1 days. Approximately 460 cases were initially pending, which is routine when toxicology, histology, or additional investigative steps are required. Additionally, 289 cases required amendment with an average amendment turnaround time, 32.4 days. Cremation services remain a major component of public-facing operations. For this quarter, the office processed 2,900 cremation permits requests. The turnaround time for that was exceptionally fast, within the same day or within 24 hours. So we're still maintaining our speed with that. On the financial side, of the invoices issued for cremation permits, 1,639 were paid this quarter, with an average payment time of 48.77 days, which is about 6 weeks. There are 1,261 outstanding invoices, averaging 39 days outstanding. We continue to monitor aging invoices and implement strategies to improve our overall collection. So that's something we're focused on. So in summary, the majority of our accepted cases have a full autopsy. About 60% of our cases receive full autopsies. Histology and cause of death determinations are progressing within the expected timeframes. Cremation permits are being processed rapidly, minimizing delays for funeral homes and families. And financial performance shows timely payments of most cases, but outstanding invoices remain an area of focus. So I'm going to stop there and ask if you have any questions.
Thank you. Is there, can we possibly get that report?
Yes, it should be in the packet.
Oh, okay. I guess I
Yes.
didn't look far enough. Okay.
Yeah.
All right, Commissioner, thank you. Commissioner Kleen?
Thank you, Madam Chair. Not a comment, not a question. I'm delighted to see these numbers every quarter. Because I know 4 or 5 years ago, took forever to get the histology work done, the toxicology work done. We were sending it all over the place and things just took too long. So I'm just delighted to see the efficiency and very important service. So delighted to see the numbers. Thank you,
Thank you.
Madam.
Anyone else? Commissioner Anderson?
Thank you, Madam Chair. Just really quick, I just wanted to ask about, do you have any plans to try to lower the number of outstanding invoices? Is there something that's lacking in that, being able to collect the money for those?
Yes, we have made significant improvement in the payment of those invoices. We've actually just placed an ATM in our facility and constantly working on our electronic payments. I think with those two systems in place, we will increase that. And then the team has been working, calling, to get those invoices paid. So we will see a decrease in those invoices in the future, and we have seen a significant decline already.
Is there something in the process where there, I would assume those are invoices due from a funeral director,
Yes.
that they're able to monitor how many they're getting from that one, and maybe, I don't know what alternative you would have. I'll leave that to you, and maybe we'll see what happens in the next report.
Yeah. Yep.
Thank you.
Thank you. Anyone else? All right. Thank you so much
Thank you.
for that wonderful report.
Move to receive and file, Madam Chair.
Support.
Been moved by Commissioner Kleen and supported by Commissioner Maraki. All in favor? Any opposers? Having none. This is received and filed. Thank you. Next item, please.
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
I don't know of any. All right, next item, please.
G, public comments.
Is there anyone online that wishes to speak? Anyone online? You see anyone?
There's no one on Zoom indicating that they would like to speak.
Thank you. Is there anyone in the audience that would like to speak? Anyone in the audience? Hearing none. Thank you. Next item, please.
Adjournment.
Been moved and supported. All in favor of adjournment? Aye, aye. Thank you so much. Thanks everyone for attending. Huh?